Now to 7 on your side, health matters today. Post-traumatic stress disorder, also of course known as PTSD, is often associated with members of the military or others who've been in major catastrophes or assaults. But there's a recent Johns Hopkins study that found many ICU patients actually suffer from PTSD. And joining us now, Dr. Ann Parker, a fellow at Johns Hopkins, and I know you helped to lead this study, which is really quite interesting. And you said you worked on it for some 2 years. How many people are we talking about that this really affects?
Yeah, so what we know about people who survive a critical illness or ICU stay is that they can have a number of complications. So these can be impairments in cognition, physical function, and mental health. And one aspect of this is PTSD symptoms. And so in this systematic review, we found that between 1 in 5, 1 in 4, and 1 in 5 patients experience clinically important PTSD symptoms after their ICU stay.
And it makes a lot of sense when you step back and think about what these people are going through when they end up in the ICU. Are there things now that you're learning from this study that can be helpful to people who are experiencing this?
I think so, definitely. So we were able to elicit some risk factors, so that things that make people vulnerable to developing PTSD symptoms after an ICU stay. And some of these risk factors include a history of anxiety or depression, also receiving certain types of sedating medications in the ICU, and then having memories of frightening experiences around the ICU stay. So things like memories of blood pouring down the walls, floating faces, patients thinking that they were being assaulted when in fact they may have had a chest tube placed to help drain fluid or air from around the lung.
And what do you, if you identify a patient who perhaps is experiencing this, are there certain things that they can do to help alleviate some of the symptoms?
So I think one thing that we realized is that limiting sedation in the ICU. So at one point in time, we thought that the best thing to do was to keep our patients sedated and asleep while they were receiving life support, things like mechanical ventilation and medications to support their blood pressure. But we now know that really patients may be doing better if we keep them awake and have them be a part of their care. So one thing that we can do is to limit sedation in the ICU. The other thing that we found in the study is that using an ICU diary may be helpful.
And that's for them to keep a diary or for the doctors?
Right, so the idea is that the patient's family, loved ones, caregivers keep a daily diary of what's happening to them and also what's happening at home while they're in the ICU. And then once the patient is awake and alert and even discharged from the ICU, they can go back and review this diary. And I think it may help them to process what happened during the ICU and hopefully prevent or treat some of these distressing PTSD symptoms.
All right, thank you so much, Dr. Ann Parker from Johns Hopkins. Really interesting study, and we appreciate your time today.
Thank you for having me.
Walk us through it.
Yeah.
All right, have a great day.
Thank you.
Thank you.